What if I told you you didn't have to settle for blah sex? Would you want to know more? If you answered yes, or even if I piqued your interest a little bit, keep listening to learn more. I'm Dr. Sonia, a double board certified OBGYN and urogynecologist. For those that don't know what a urogyne is, in a nutshell, I specialize in female pelvic health. Everything from incontinence and prolapse to pelvic pain, sexual function, and menopause. With Valentine's Day fast approaching, I thought it was the perfect time to take a deeper dive into sexual wellness. It is not uncommon that after we have babies, as we age, or during the menopausal transition, our desire for intimacy and sensation with intimacy declines. For many years, we just had to accept that there wasn't any options for women. If you haven't heard, please let me be the first to tell you that's no longer the case. The O-shot, or orgasm shot, is a non-surgical procedure aimed at improving sexual health and experience for women. It's a simple in-office procedure that's painless and takes about 3 minutes to perform after you've sat with a numbing gel on for about 20 minutes. It involves the use of platelet-rich plasma, or PRP therapy, a technique that utilizes the patient's own blood to promote healing and rejuvenation in targeted areas. PRP has been used for over a decade in various fields. Oral maxillofacial surgeons started using it in the early 90s when doing bone grafts to help with quicker healing. Athletes use it for injections into sports injuries instead of or in addition to steroids. You may have heard of a vampire facial, where PRP is combined with microneedling to improve the appearance and texture of our skin, eliminating fine lines and wrinkles, age spots, and acne scars, just to name a few things. We can inject it into the scalp to help with hair growth for people who are suffering with thinning of their hair. In my world, I can use PRP for sexual health and pelvic health and bladder health. When platelet-rich plasma is injected into the clitoris, the labia, and the G-spot, these areas experience increased blood flow and new healthy tissue growth, which improves the growth of blood vessels and nerves in the area. And the more nerve growth, the more sensation you'll feel. Although PRP for sexual health is not an FDA-approved procedure, it is a common procedure. It's been done for years with excellent results and plenty of research to back it up. It's actually one of the most popular procedures that I perform at Allure Pelvic Wellness. Here's a breakdown of the procedure itself. Number 1, blood collection and PRP preparation. Small amount of blood is drawn from the patient, similar to a routine blood test. The blood is then placed in a centrifuge where it is spun to separate the plasma and the platelets from the other components of the blood. This process concentrates the platelets, creating platelet-rich plasma, or PRP. We dispose of the red blood cells as they're not very useful to us. And what we have left is PRP, or liquid gold. Step 2. As your blood is being processed, you get to relax in our treatment room with a very potent topical numbing gel applied to the vagina and the clitoris. Step 3, application of the PRP. The PRP, rich in growth factors and healing properties, is then injected into specific areas of the vaginal tissue. The most common areas for injection are the clitoris and the G-spot. Yes, it does exist, and it's an area just inside of the vaginal opening on the anterior vaginal wall or ceiling of the vagina. Most women feel nothing with the injection into the G-spot and may feel a sensation of pressure with the clitoral injection just from the amount of volume going in. Step 4, go home and enjoy your newly amplified sex life. There's no restrictions after the procedure, and you could be intimate that same day should you choose. As for healing and rejuvenation, the growth factors in the PRP stimulate stem cells and promote the regeneration of healthier and more functional tissue in the injected areas. This can lead to enhanced sensitivity, improved natural lubrication, and overall better sexual health. With the O shot, everyone's experience is a little different. For some women, the difference is immediately noticeable. For others, the results are felt over the course of a couple of months. On average, results are noticed the first 3 to 7 days, with peak results occurring around 3 months. Some women do experience minimal side effects, which may include a small amount of redness, swelling, sensitivity, or numbness for up to about a week after the procedure. Not everyone is going to experience those side effects, but if they do occur, they're very mild and they resolve without any intervention. If improving the big O wasn't enough, an additional benefit is improvement in stress incontinence. That's the urine leakage we get sometimes when we're coughing, sneezing, laughing, or jumping up and down on a trampoline. And it also helps with overactive bladder. That gotta go right now feeling, where sometimes we don't quite make it to the bathroom and get our pants down before a little bit of urine escapes. The O shot is often sought by women experiencing sexual dysfunction, decreased libido, or those looking for enhanced sexual experience. But it's also used by some women who just want to treat the urinary incontinence, as the rejuvenation effects can strengthen the relevant tissue that supports the urethra. It's important to note that the effectiveness of the O shot can vary from person to person, and it's not a guaranteed solution for all sexual health issues. In my practice, I follow up with all of my patients 3 months after their initial O shot. About 70% of women report that they are highly satisfied with their results. The other 30% have noticed improvement but wish it could be a little bit better. And for those women, I recommend a second O shot at that time. All people have a higher success rate after the second procedure. Here are some of the indications with the most likely benefit. Number 1, women where the orgasm is decreased but present. Number 2, dyspareunia or painful sex where you're not really sure what the cause is. Number 3, chronic interstitial cystitis or bladder pain syndrome. Number 4, women who have had vaginal surgery with transvaginal mesh in the past and now have pain. The procedure will usually attenuate the pain, but it may not completely relieve it. Number 5, pelvic floor pain or trigger point pain. Number 6, stress urinary incontinence when the pelvic floor is still mostly intact. Number 7, urge incontinence. And number 8, lichen sclerosis. There's one problem for which the O shot is less likely to be helpful, though it does seem to help about 30% of the time. And that's when a woman has never had an orgasm in the past. This is more likely to respond to testosterone replacement and sex education or counseling. I hope you found this video helpful and that I've answered most, if not all, of your questions about the O shot. Please feel free to leave questions and comments in the comment section, and I will do my best to address each of them. If you're interested in learning more, asking questions of a more personal nature, or if you're ready to book your appointment for your O shot, please find my contact information in my bio and don't hesitate to reach out to schedule a consultation. As always, continue to like, follow, and share. I'm Dr. Sonia Ephraim from Allure Pelvic Wellness.